I'm Terri Kane. I'm the administrator here at Dixie Regional Medical Center, but when I first came to St. George, I was recruited as the Chief Operating Officer. And it was an exciting time in St. George. There was a piece of property that had been purchased here from the Formaster family, and it was going to be a beautiful medical center. Whenever you move into somewhere new and it was bigger, we had to make sure that supplies and medication and personnel and the paperwork, all the computers worked and everything, so that we could do business as usual when the patients were received over here. We didn't have one incident. It went like clockwork, moving patients back and forth. We discharged as many patients as we could and tried not to admit any more during that time period, but we still had a number of patients that had to be moved, and we got that all done in one day. And as luck would have it, build it and they'll come, we far exceeded the 20 to 30% growth that we'd anticipated. And we were placing patients in rooms we hadn't anticipated using. And we had many people in our hospital that have RN degrees, myself included, that were in other jobs, whether they be in casework or education or in administration, that pulled a few shifts. I have to say I've never worked as hard in my 30-year career as I worked during those 3 years of moving to the River Road campus and trying to get everything stable. Well, I remember we had been in the River Road campus all of 1 week, and that weekend there was a major 2-car rollover out in Colorado City with a number of young kids that were driving too fast on the road, and I remember there was like 8, if I remember right, teenagers that were seriously injured involved in that, and we needed all of our trauma rooms. If we had not been in the River Road Hospital and been on 400 East, we would have had to have shipped those patients and not been able to help them with the capacity we now had in the River Road campus. So I just remember how grateful everyone was that we had just-in-time new facility to be able to give good care. On the heels of that, this was 2 weeks after our first open-heart surgery patient had been operated on. So we moved in November. We did our first open-heart surgery patient in December after 3 years of planning. And one weekend, about 3 weeks into this, we had a young father, he was 40 years old, that had come into our emergency room with crushing chest pain. And our emergency room physicians diagnosed him as not having a heart attack, but as having a ruptured aorta, which is a major blood vessel that supports blood to the human body. Typically, if you're not in a major medical center where it has major heart capabilities, you don't even have a chance of survival because patients bleed. This was on a Saturday, and we came into our hospital. Our cardiac program was up and running. Our 2 cardiac surgeons were in the hospital. Diagnosis was made in 20 minutes, and the patient was in the operating room. And the long story short is 4 days later, this father who had 4 children walked out of our hospital. 2 weeks before that, he would have never made it.